Hey everyone, welcome back. Today, we're going to be diving into something that
Yeah,
I bet a lot of you have thought about
hmm
if you've got little ones,
for sure.
especially these days. We're talking about flathead syndrome in babies.
Right.
We're looking at this really interesting article, this clinic in Bristol that's doing some pretty pioneering work.
Definitely. It's fascinating stuff.
So to start things off, like what exactly is flathead syndrome? I feel like we hear those words thrown around, but
Yeah, it can be a little confusing.
yeah, like what are we actually talking about here?
So basically, we're talking about either plagiocephaly
Okay,
or brachycephaly.
those are some words.
I know, right? But basically, it just means that a baby's head
Yeah,
might be a little bit flattened
gotcha.
on one side or the back.
Makes sense.
And it's actually way more common than you might think.
Really?
This article said up to 40% of babies might have some degree of it.
Wow, 40%.
Yeah, it's a lot.
It's a pretty big number.
It-
So is this like a new thing? Why are we seeing so much of it?
Well, it's kind of tied to all the advice about safe sleep for babies.
Oh, okay.
You know, the back to sleep campaigns,
Right, right.
which, by the way, have been amazingly successful
Oh, for sure, yeah.
at reducing SIDs.
Absolutely.
But because babies are spending more time on their backs,
Makes sense.
it can increase the chances of them developing a flat spot.
So it's kind of like a side effect almost
Yeah.
of something that's actually really, really good for them.
Exactly. It's a bit of a trade-off.
But how worried should parents actually be if they notice their baby's head is a little flat?
Well, most of the time, it's really nothing to worry about.
Okay, that's good to hear.
Most cases are pretty mild,
Okay.
and they just kind of resolve on their own
All right.
as babies get a bit older.
Yeah,
And they start moving around more and, spending less time just lying down.
gotcha.
But for more severe cases, then you might need to think about some kind of intervention.
So that's where this clinic in Bristol comes in, right? This is the only NHS clinic in the entire UK
Yeah.
that offers,
It's pretty amusing.
yeah, it's incredible, that offers helmet therapy for flathead syndrome.
hmm
So what is it about this clinic that's so unique? What are they doing that's different?
Well, for one thing, they're addressing a really big issue, and that's the cost.
Okay.
Because private treatment for this
Oh, yeah.
can be insanely expensive.
Yeah.
We're talking like £2,500.
Wow.
Which a lot of families just can't afford.
Yeah, of course not.
So this clinic is really helping to make treatment more accessible,
That's great.
which is amazing, but there's still a ton of demand.
I can imagine.
The waiting lists are really long,
Yeah, I bet.
but it shows just how much of a need there is for this kind of service.
Well, and the article talks about this mom, Becky, and her baby, Leo.
Yes, it's such a good example.
And she was seeing that his head was flattening,
Right.
and she felt completely lost, like there just wasn't enough information out there.
Exactly, and that's something I hear from parents all the time.
Oh, really?
They feel like they're just kind of left to figure it out on their own.
Which is really scary,
It is, absolutely.
especially when it comes to your baby's health.
Yeah, you want to make sure you're doing the right thing.
So, okay, let's talk about this helmet therapy,
Okay.
because I think a lot of people are probably wondering, like, what even is that?
So essentially, it's a helmet that's custom made
Okay.
from a 3D scan of the baby's head.
Oh,
And they wear it pretty much all day,
all day.
23 hours a day, to be exact.
Oh, that's a lot.
Yeah, it's pretty intense.
And the idea is that it gently kind of reshapes the skull as the baby grows.
Exactly.
But 23 hours a day, I mean, that has got to come with its own set of challenges
No, for sure.
for both the babies and the parents.
Yeah, I mean, imagine trying to feed a baby with a helmet on,
Right.
or play with them, or comfort them.
It's a big adjustment, yeah.
And then there's the potential for side effects.
Like what?
Skin irritation, pressure sores.
Mm.
Oh, God. Even changes in their sleep patterns.
Oh, wow.
So it's definitely not a decision to be taken lightly.
No, absolutely not.
There's a lot to consider.
And you mentioned earlier that even the medical community is kind of divided on this.
Oh, yeah. There's definitely no consensus.
So what's the main point of contention? Like, why is there so much a debate?
Well, a lot of it comes down to the lack of clear evidence.
Evidence that it works.
Exactly, that it actually makes a difference.
Interesting.
Some studies have shown that repositioning techniques,
Okay.
or even just letting the baby grow naturally,
Yeah.
can lead to similar outcomes.
Oh, wow.
And even the NHS itself doesn't fully endorse helmet therapy
Really?
because of those uncertainties and the potential side effects.
So, I mean, with all this conflicting information, how are parents supposed to make sense of it all?
It's tough, right? But that's why it's so important to talk to your pediatrician
Yeah.
and do your research
Mhm.
and really think about what's best for your individual child.
So it sounds like there's no one-size-fits-all answer here.
Definitely not.
It's really about figuring out what's best for your family and your baby.
Exactly.
So I guess the big question is, with all the risks and the uncertainties, is helmet therapy ever worth it?
Well, that's where it gets really tricky.
Yeah.
Because there are some babies who do seem to benefit from it.
Okay.
And the article talks about this researcher, Amy Davey,
Right.
who's actually working on a tool to help assess babies and
Interesting.
figure out who might be the best candidates for helmet therapy.
Oh, wow. So that could really change things.
Yeah, it's really promising work
That's awesome.
because it's all about trying to make treatment more personalized.
So let's get back to Becky and Leo.
Okay.
Because in the end, she felt like helmet therapy was the right choice for them.
Right. And I think that's a really important point to make.
Yeah.
That there's no right or wrong answer here.
It's a personal decision.
Exactly.
Yeah, you have to weigh all the factors.
And trust your gut.
Yeah, absolutely.
What feels right for your family?
Well, this has been a really fascinating
It really has.
deep dive into a surprisingly complex topic.
More complex than I think a lot of people realize.
For sure. So what's your final thought for our listeners today? What should they take away from all this?
I'd say the biggest thing is just to be informed
Yeah,
and have open conversations with your pediatrician.
right.
Learn about all the options.
Not just helmet therapy.
Right. There are other things you can try.
Yeah.
Repositioning techniques,
Mhm.
encouraging tummy time during the day,
Right.
and, sometimes just monitoring the situation is enough.
And trust your instincts.
Absolutely.
As a parent.
Yeah, you know your baby best.
So do your research,
Mm-hmm.
talk to your doctor,
Yes.
and trust your gut.
Couldn't have said it better myself.